Cumberland County is part of a 10-county region that received a 5-year community transformation grant designed to create a healthier community. Akeed Harris with the Cumberland County Department of Public Health explains the steps being taken to help transform our community and region. These include decreasing exposure to secondhand smoke, increasing access to healthier foods, and opportunities for citizens to be physically active.
The Community Transformation Grant Project is a 5-year regional effort with the goal of creating healthier communities by basically making healthy living easier where people live, work, learn, and play. The project aims to create healthy communities by doing a few things. What we want to do is promote healthy living. We want to make sure that we reduce chronic disease. We want to improve health status. We want to reduce health disparities, and we want to control healthcare costs. Our region, which is Region 6, actually covers 10 counties. Cumberland County is the lead county, and it also covers Hope County, Harnett, Lee, Moore, Randolph, Montgomery, Anson, Scotland, and Richmond counties. The Community Transformation Grant Project is actually divided into 3 strategic directions, is what we call them. The first is tobacco-free living, the second is active living and healthy eating, and the third is clinical preventive services. So when we look at tobacco-free living, what we're doing, we're actually working with local elected officials to make our county buildings, county grounds, vehicles, and in some cases our indoor public places tobacco-free. We're also working to increase the number of multi-unit housing developments that are smoke-free. And then we're also working with our local community colleges and private colleges and universities to make those tobacco-free as well. When it comes to healthy eating, there are 2 strategies that we're using. The first one we're actually increasing the number of new or enhanced farmers markets, farm stands, or community-supported agricultural programs. And then we're also working with our small retail stores, or if you see here maybe in Fayetteville, they're kind of called corner stores, working with them so they can actually offer and promote healthier food and beverage options as well. And with our physical activity piece or active living, what we want to do is find places within the community where people can actually be physically active in a safe environment. So we're reaching out to churches, schools, maybe a business that has a parking lot or vacant lot, and people can be physically active there and be in a safe environment. Because what you find a lot of times is, traffic is dangerous. Some places don't have sidewalks, so we have to find a place within the community for people to be physically active. And then our last piece is our third strategic direction is clinical preventive services. We're actually working in conjunction with our area health education centers. So here in Cumberland County, that'll be SHRAHAC. And what we're going to do is provide them with a list of community health resources that they will then funnel through to primary care physicians that they're working with to help in care planning. So we're looking at their patients who suffer from diseases or conditions such as heart disease, high blood pressure, high cholesterol, obesity, and tobacco use. The Community Transformation Grant Project is actually a grant who was actually funded through the Centers for Disease Control. The state of North Carolina Department of Public Health actually applied for the grant, and individual regions are actually sub-grantees for the funds. So what the Department of Public Health of the state of North Carolina, what they did, they realized, and statistics show this, that the leading cause of death in most of the counties, if not all the counties, are cancer. In particular, we're looking at lung cancer, heart disease, stroke, and diabetes. If you look at the risk factors for these conditions, they include tobacco use, poor nutrition, and physical inactivity. That's what CTG actually covers, and that's what we hope to focus on. Recently here in Cumberland County, we worked with one municipality, which is the town of Spring Lake. We also work with Cumberland County to work on some smoking related policies. So in the town of Spring Lake, they actually adopted an ordinance which prohibits smoking and tobacco use in government buildings, government vehicles, and on government grounds, which includes their parks. There was some discussion originally about including prohibiting smoking in indoor public places as well, but the Board of Aldermen in Spring Lake, they decided that that wasn't something they felt comfortable doing right now. So they decided to leave that out of the ordinance. And then here in Cumberland County, the county commissioners just recently passed a policy. It's a no smoking policy, which actually prohibits smoking on the grounds of Department of Social Services, the grounds of any building that provides Cumberland County Health Department services, and buildings where library services are also provided. That policy will go into effect in January of next year. Also, when it comes to the active living piece, what we want to do is work with our local governments on including health considerations in their comprehensive planning. And by that, I mean that we want to make sure that comprehensive plans have greenway plans. They want to have bike and pedestrian plans. They want to have park and recreation plans. Those are the things so people can have places that they can go be physically active in a safe environment. Our region receives $420,000 per year for 5 years for the duration of this grant. Over the past few decades, the physical environment and lifestyle decisions that we've made have been pretty detrimental to our health. We've pretty much engineered physical activity completely out of our lives. If you look at the way our metro areas are designed, you look at our rural areas, you pretty much have to have a car to get everywhere. People who want to walk or ride bicycles, they're really putting their life in their own hands because a lot of places don't have sidewalks. Bicycles in the state of North Carolina have to ride on the streets with vehicles. A lot of people here, particularly in Fayetteville, there are a lot of riders get hit by cars. If we look at technology, we can do almost everything while we're sitting. We watch TV, we can sit, we don't have to get up to change channels anymore, we can surf the web, people can do their jobs all while sitting. We don't have to move. If we look at our food environment, fast food restaurants are everywhere. And most of these fast food restaurants, even though they're trying to make changes, still don't offer a lot of healthy food and beverage options. CTG, or the Community Transformation Grant Project, is trying to change that. What we're trying to do is make healthy living the easy choice. We're trying to bring healthy living to the forefront of people's minds. We want it to be unavoidable in daily society. That's what the Community Transformation Grant Project is all about.